Dr. Noel, thank you so much for making time to talk Cyclospora with us.
Yes, of
And,
course.
a lot's changed since we did the AP interview just a couple of days ago.
Uh-huh.
Their cases have been reported in 34 states as of today, being July
Yes,
15th. Nothing so far in Hawaii just yet, though, right?
correct. Yeah, there has been over 1,600 confirmed cases across 34 states. None on the islands of Hawaii yet. However, there has been thought that there has been being aware of more than 5,000 cases nationwide, and we're expecting that number to grow, unfortunately.
And I think the hard thing with Cyclospora is because it takes so much time, what is it, 10 days for symptoms to
Yes.
manifest itself, that it's tough for people to kind of keep up with it.
Yeah, absolutely. So Cyclospora is something that we see annually, between particularly in the spring to summer months, May through August. But what's been so scary about this current outbreak is that we don't currently know what the main source is. In previous years, it has been traced back to things like raspberries, pre-washed salad mixtures, and other produce. However, in this particular incidence, we don't have a clear source on it yet, and that's why it's been such a scary time for some people.
Now, for a physician like yourself, is it tough
Mhm.
to, when a patient comes in presenting symptoms, is it tough for
Mhm.
you to decipher between, Cyclospora or norovirus?
Oh, absolutely. In some senses, we see some of the differences. As in norovirus, the infection is pretty much automatic, where the particular patient will have, really explosive diarrhea right away, and it stays that way. Whereas cyclospora, it does gradually get worse and worse as time goes. So there are some key differences that is traditionally seen. However, there are not everyone presents in the same exact way, so it is quite challenging. The good thing about both of these diarrheal illnesses is that it rarely causes serious complications and are not typically life-threatening. However, vulnerable people such as the elderly or immunocompromised does require hospitalizations, such as in the case of dehydration. So it is important to take food safety seriously.
And how easy is Cyclospora able to transfer? Because you hear about it
Mm,
coming in on the produce. Let's say you put something down on a cutting board. Is the
sure.
cutting board now susceptible?
Technically, if so, Cyclospora, it is first and foremost nothing that is contagious, as in it cannot be passed by person to person. It is transmitted by when people consume food or water that is contaminated with human feces containing the oocytes or the eggs of the parasite. So, in theory, if that particular produce had the contaminated human feces and it got transferred to the cutting board, yes, it is possible that it can be transmitted that way as well.
Wow. And yeah, I think this really kind of brings up some of the tips that you were giving of how to properly wash and how to
Mhm.
properly prevent you from getting this parasitic infection.
Yes. So the past cyclospora outbreaks we know have been linked to fresh produce. So some of them include raspberries, basil, cilantro, fruit mixes, snow peas, snap peas, lettuce, and salad mixes. They have been caused by both imported and domestic fruits and vegetables that are prepared at home and in the restaurants. The best way to prevent illness is to first and foremost, follow standard hygiene and food safety practices. So, first and foremost, we say washing our hands with soap and water after using the bathroom and before and after preparing food is important, as alcohol-based hand sanitizers do not kill cyclospora. However, soap and water does. So, in terms of other practices that's been shown to being helpful, is, of course, rinsing fruits and vegetables with with water is always a great practice. But it reduces their number from being on the actual fruits and vegetables. More specifically, what's been shown is that cleaning produce with vinegar has been more effective than just running water on its own. For example, 1 part vinegar, 3 parts water. Um, it doesn't kill the cyclospora, but it helps the cyclospora detach from the fruits and vegetables, which has been shown to reduce the risk of getting sick or making the illness less severe. So, however, during this time, if we would like to be the safest, produce is safest when it's heated to 158 degrees or higher, which actually kills the cyclospora. Maybe I'll talk a little bit on how we can clean specific produce. Like, for example, instead for our lettuce or our salad mixes, as opposed to writing as opposed to purchasing pre-mixed salad kits, we do recommend buying whole heads of lettuce, discarding the outer 2 or 3 layers, and washing the inner leaves thoroughly with running water or that vinegar mixture that we had talked about. The vinegar mixture, some people might be worried about the aftertaste. If you use a spinner afterwards, that vinegary taste usually goes away. Other things such as fruits with crevices, such as raspberries or strawberries with the bumpy surfaces, we actually recommend cooking them in pies or jam at this time to greater than 150 degrees because we know that that's been linked to previous cyclospora outbreak. Freezing them can reduce the number of parasites, but probably not entirely, so we do recommend cleaning. Other things like cilantro and basil, those small leaves, we do want them to be washed thoroughly, separating the leaves in order to decrease the chances of an outbreak. For green onions, we'd like for you to trim the root end and removing the outer layer. And for even things that maybe you don't eat the rind, such as a melon or a watermelon, scrubbing the outer surfaces of it is very important, and even cleaning it with soap and water, as if you put the knife through the rind and it was infected, it could infect the fruit inside. So those are some tips and tricks for specific produce that we've been telling the general public.
Got it. So, like, when in doubt, just cook it.
Absolutely. When in doubt at this time, it's the best thing to cook if that is available to be done at this moment.
Now, one of the things that, I took a note on when you were talking about is like when you're
Mhm,
washing the produce and you're
mhm,
talking about how it detaches from the
mhm,
produce when you submerge it underwater. How would that
mhm.
present itself? Would I like see eggs rise to the top of the water?
That's a good question. Cyclospora are so small that unfortunately we won't see the parasite itself. I mean, we might see some dirt or other things that come with it. However, we won't see the cyclospora. Cyclospora are so small, they're actually a single cell parasite. So it's not visible to the naked eye, unfortunately. So we just have to visually imagine if we do the chemical or vinegar washes, it does help. It does help the cyclospora release itself from the produce, but do not reliably kill itself.
Got it, got it. And, you know, living in Hawaii or even one of
Mhm,
the states that just haven't seen a lot of cases yet, what
mhm.
should people be doing? Is this kind of a time to buy local?
Yeah, absolutely. I would say that most of the cases, we have not seen these outbreaks from local farms or one particular source. I think the main message we would like to get out is important for our communities not to panic. And it's definitely not a time for us to completely avoid fruits and vegetables altogether. Want to make sure everyone's still eating very healthy at this time, but it's just most important to practice washing and handling is probably the best way for us to practice healthy living at this time.
And again, talking about not panicking, I think something that is good to point out is that this is something that is not uncommon. It's seasonal. You see this every year, maybe just not to this extent.
Yes, absolutely. So it is something that it is part of the reportable diseases to the Department of Health, and we do see some cases every year throughout the nation. So it's relatively common in the sense that it happens throughout the nation every year, just not to this degree. So that's why we ask everyone not to panic. And one of the greatest things about Cyclospora is that there are treatments for it. We always say do not take over-the-counter antidiarrheal medications like Imodium or Pepto-Bismol without the consultation of your primary care physician, as sometimes these medications are not always recommended. And what's interesting is that even though it is a parasite, it's been found that an antibiotic is very effective in treating cyclospora. So if there are severe illnesses, everyone can and should seek treatment at this time.
Perfect. And so, if you do get this, this is something that can be treated. It's just going to be a rough few days.
Absolutely. I mean, the cyclospora infection, the symptom range is it looks like a typical stomach bug. Diarrhea, nausea, feeling tired, cramping, and bloating. Because of that, actually, many cases fly under the radar. Some people ride the illnesses out at home rather than seeing a doctor. And most of the time, people will recover from the illness on their own, with symptoms resolving within about a week or so. So it is definitely not something to panic about. Again, it's important for us to be aware, but not panic about the cyclospora outbreak during this time.
Perfect. Any other advice for states where we're not seeing a lot of cases right now?
No, nothing in particular. We always say that even though we can't eliminate our risk completely, um, it's just important for us that we go back to the basics and always wash our hands. If you are sick, please do not prepare food for yourself or other people. Make sure to call out sick and know that the alcohol-based hand sanitizers do not kill the cyclospora. So always go back to soap and water hand washing for at least 20 seconds.
Perfect. Anything else that you wanted to add?
No, that's all for today. Thank you.
Thank you, Dr. Noel.